Hello, hello. It is your girl M here with Just Ask M. I am joined by the Dr. Kara. Say
hello.
Hi. And you are in physical therapy.
Yes.
Correct?
Yes.
Okay. We'll dive into that a little bit later. I always do like to just start out with what is a little bit about Kara.
So,
am I saying that right, Kara or Kara?
It's Kara.
Kara.
I get everything.
Yes.
Yeah, so I actually grew up in Buffalo. I'm a local, and it's funny, I actually wanted to move away, but honestly,
I think we all do at one point.
It's kind of cold here in the winters, but with COVID and everything, I ended up, realizing like family's important, and I want to stay around family. So, but I went to Damon College, graduated in 2020, so that's kind of why.
Oh, right there.
Right at that time that I was like, oh, I need to make life decisions.
That was like a fork in the road, like, what do I do?
Yeah, exactly. But, so yeah, I've basically been practicing PT since then, and have loved it. Okay. I've loved kind of the community that I've made with patients the whole time. But, my spare time more so like about me specifically, big, I guess, outdoor person. I like to hike, kayak. Winter hobbies, I'll say, are sewing and reading because it's hard to sit inside and do all that stuff when it's so nice outside.
I was ready for like skiing or something, but that's much cozier.
We do go skiing too.
Yeah.
So, I guess, it's all relative. People
what do you sew specifically, if anything?
Well, I can't say what I'm making right now.
Oh, okay. We'll stay tuned.
Christmas gifts. So.
Okay, very nice.
But last year for Christmas, my husband actually got me this like sweatshirt to sew, like sweatshirt pattern thing. So I made my own sweatshirt, but it's by no means professionally made.
That's okay. I mean, like I said, perfectionism. It's overrated.
Exactly,
it's just a little overrated. So what made you interested in becoming a physical therapist?
Yeah, so it's actually funny. Most people who have been PTs usually have gone through physical therapy themselves. I have never actually done that. I probably should have. I've sprained my ankle a couple of times. So, but it's funny, my sister actually tore her ACL.
Ooh,
and just kind of seeing her go through all the exercises and everything, it made me interested in it.
Really?
Because I knew I wanted to do something in math or science, and I knew I wanted to like help people. And so I think like sitting behind a desk all day just seemed...
You have too much good energy. The minute you walked in,
like, I can't do that.
And it's good to know that about yourself.
Yeah, and but I don't like blood or needles, so like I can't.
At one point I considered an RN, and I'm like, no, the smell of stuff, and I'm like, I'm like, no.
Honestly, still to this day, some things I'm like, ooh. But so I was like, once I saw that, I was like, okay, like that's helping people.
Yeah. And I was gonna say that's a good combination between the math, science, and the helping people. That's almost like perfect.
Exactly. Yeah. So it's logic that brought me here. But like I said, I've enjoyed it since then, and it's been a really happy journey and fulfilling and rewarding so far too, and seeing people get back to doing things that they love doing.
It's satisfying. It's rewarding.
Yes, exactly. And people do really appreciate it versus some doctors you go to and
you're fine, get up and go.
Yeah, exactly.
Walk.
Exactly. And I try to take like the extra time to like really dissect and see like where the root of the problem is coming from.
So many things I can talk on that based on my previous experience, because I've actually have been a medical assistant in several different specialty offices, worked with, doctors, you see empathy, bedside manner, or the lack of. So one thing, and I currently do home care part-time with a client in his home. Yeah. So with all that being said, you're the perfect kind of person people want to see walk in. And one of the biggest things that used to bother me, it bothers me what the health industry has become these days are insurance card and ID. I'm good, thank you. How are you?
Yeah.
Just those people are in pain. People are miserable. People are sad.
Right.
So the last thing you want is like this cranky person coming in. Come on, let's get to your exercise. And it's like...
Right. No, definitely.
Super excited now,
I mean, I could have a whole nother podcast for insurance.
Oh my gosh.
In the healthcare system these days.
So a couple of questions. You graduated in 2020. I have an idea of like certain things where doctors, you got to do the residency, this and that. How does that work with PT? Do you start under somebody first?
Honestly, so through depending on the schooling, it just is, or like which school you go to, it depends like how they set it up. But through the years that I was in grad school, like summers were clinicals.
Okay.
So it's like a mentorship, basically. And it was actually in the middle of my last clinical that COVID hit. So that kind of got a little crazy there at the end. And then taking the board exam and everything too.
Yeah.
I actually ended up traveling to like West Virginia with my friend to take it.
Make a day out of it.
Well, because I was like, I'm ready to take it now. I'm not delaying.
That's
like,
good.
I was like, I'm not gonna like wait another 3 months and then study again. But then pretty much right after school, you get a job and you start. And you know, you should like jobs will help you like
build it up.
Yeah, exactly.
Because you're completely independent now, right?
Now I am.
Yeah,
yes.
very good.
So
wow, so that's a pretty extensive process to like. That's what I'm saying. Like, I feel like a lot of these industries, you don't. Like, even I was a dental assistant at one point. I had no idea how much schooling that was. I'm you know. So these industries, it's just like people always have this image of like doctors, like there's like, but like that's a pretty extensive process that I wouldn't care for. Yeah, I don't really school that much.
And it's funny too because there really is kind of a lot of on the job learning as well. And you know, you don't. People are like, oh, did you learn like these exercises in school? Like, no. Right. You learn the exercises through job training,
like doing them.
But it's still great, and like it all comes together after school. Because while you're going through school, you're like, okay, I understand the concept, but like actually putting it into practice.
That's
like,
my biggest complaints about school. It's just like, and I know it's required, especially like in these industries, obviously learning the body and, you know, muscles and everything.
Oh, yeah.
But for me, I messed myself up because I got a lot of experience and then I tried going back to school, and I went back to school and I'm looking around like, you do not use this.
Right.
Literally. And I'm just like, I can't, you know, and like I said, like the best. And that's funny that you mentioned that because I just made a little video the other day where it's just like education is great, but I feel like the best is experience.
Oh, 100%.
Because you can say, okay, bend your joint this way. Okay, like what is it doing? But if you show me and you explain it, then I'm like, okay, got it. I'm just a visual learner.
Yeah.
So it's different for everybody.
Well, in schools too, they kind of teach for the test, for the board exam.
Right.
And then it's just like, so life experience does play a big role into it. But that's kind of why I wanted to do like independent stuff myself, just so I could, you know, kind of piece it all together. I kind of see myself as like an engineer of the body.
Absolutely.
Right. And so a lot of times with PT, like I've worked with people who are coming for their elbow and it's like, well, you know, you work on the elbow, but it's not getting better. And then I'm like, let's try this. And we start working on the neck and it clears right up. Yeah, you know, and I mean, they say in school to like screen the joints above and below, but the joint above would be your shoulder.
Right.
So it's, I don't know. I've just really loved like, taking those steps back and being like, okay, let's try something like that doesn't seem like an issue at all. Let's work on it and see what happens. And then it's just, again, so rewarding.
Right.
When I hear,
and the beauty of that is like, I have so many, I'm like, Jane of many trades and a bunch of different pages happening. But what I love about it, if you know about me, is like customized and personalized.
Yes, definitely.
So, and I feel like a lot of the time people don't realize how many industries I can actually relate to versus all the way up to a podcast, to event planning, to the health industry.
Yeah.
But I say that to say, like, even in my time in the medical field, it helped me learn so much about people. Because the reality is, if you understand people, if you understand business, and you develop a process, you won't fail at almost anything.
Right.
So with that being said, it's like you. So like I do a lot, probably do too much. I'm on a computer all day.
Yeah.
I'm on, you know, my phone is never in my hand, but it's up there. So now I'm like, ooh, okay, I got pain here. You know what I mean? But then it's like my neck tension is probably terrible.
Right.
I sit a lot. Now I got tension in my lower back.
Well,
you know.
Yeah, it's funny because I say everyone's here these days.
I know.
You know, everyone's here. You hate to say it, but we are. And not only that, but maybe even like here.
I will say, I don't know where I've become so conscious of my posture and I've gotten very good at it. But then also too, if I'm on my phone, I try to bring my phone to me. You know what I mean?
Definitely.
Because it's brutal.
Well, and again, I'm a big reader. I almost
yes.
I don't know if you've ever seen those glasses that you put on that have the mirror at the 45-degree angle.
No,
they look ridiculous. But I'm like, low-key kind of want some, so you're not just like looking down the whole time.
Oh, and you're like, I got it.
So
That's
you're sitting
hilarious.
here, but like you can see the book that's down here. Yeah. Yeah.
Okay, interesting. So yeah, and like I said, to your last point of like, when you walk in, somebody says pain, in one area, but you suggest another. There's such an importance in that, especially in the medical field. Like this is a real thing. Like I really have worked a lot of jobs. I used to be a medical assistant in a pain management office. But the beauty, I mention all these things because the beauty of it is it helps you to understand so many different kind of, people, different stages of their life. People are struggling out here. People have like pain, and then, somebody like you with the energy that you have, like, you're genuinely invested. Let's try something else, and it actually works. That is a form of kindness. That is a form of like hope, because it's just like, imagine you're waking up every day in pain and no solution to it.
Yeah. It's funny because like, yes, I do obviously work with people in pain, but I tell people, I'm like, you saying ow does not affect me because everyone says ow.
Right.
I'm like, I will give you some sympathy, but also I'm like, but sometimes you have to push through some of the, like PT it kind of somewhat creates pain, we'll say, because we're moving tissues differently than how they want to move. Right. So I'm like, sometimes we have to like make pain, but it will feel better afterwards.
Just tell them pain is weakness leaving the body. That's what I tell myself. Right. Beauty is pain.
But like, yeah, you have to like, I mean, I'm not like, suck it up. Just do it. But like, you're like, oh yeah,
and
but also
you'd be surprised. And that's what I'm saying. Like you could call it bedside manner because you are a doctor, and that demeanor where it's just like, yeah, they're already missed. But the last thing they want to say is suck it up. It's like, are you in this pain? You know what I'm saying? So it's the mindfulness of that, and that's like, good for you. I mean, 5 years later to be independent, I think that's great.
Yeah.
I might not understand the timeline of physical therapy completely.
Well,
but
it's it's definitely something that I wanted to focus more holistically on people, for sure. So that's kind of why I started taking that route. Again, just because I say it a million times a day, but it's all connected, so I can't, how can I treat you well if your elbow pain's coming from your neck? You deserve more than just your elbow being treated. So,
and that's not very common in the healthcare industry, that attention to detail and understanding. And if you were working under somebody, that mindset would probably be challenged because you are working under somebody. So independently, good for you. I mean, holistic first, all day. And then obviously if there's some things you can't help, then, move to the next thing.
I've even thought about doing like becoming a functional medical provider. I'd have to look into it a little bit more, but it somehow like connects into PT and, but it's something I have considered too, just to, again, kind of bring it all together. And so then I can practice that way too. But like I said, I more so just holistically focus on the body and how it all works together and not just so zeroed in on one body part. Yeah.
And that's one of the best things too, like certain industries, and that is one thing I did like about the medical field. The possibilities were endless because there's, like you said, I mean, the amount of nerves, muscles, things in the body.
Right.
Like you said, you can branch off to so many. So it's nice that you kind of have your platform currently.
Yeah.
And then, you continue building.
And I mean, kind of going off of that, like one of the areas that I really like to treat, obviously, is like the pelvis, low back area. Which is,
tell me more, please, as I sit here with some tension and pain. But everything's fine.
But that's kind of why I got into like pelvic floor too. Like I started doing some of those classes and realized like a lot of people have pelvic floor issues. I didn't realize it, but I do have some because I broke my tailbone. Actually, it was like 2 weeks before I started grad school, so that was super, super fun.
You kept going.
Yes.
How may I ask?
It's a long, complicated story, but it was not fun.
I can imagine.
Yeah. So you got to think like, again, tailbone's broken, comes forward, pulls all the muscles with it, because again, it's all connected. But like basically, again, treating like the low back area to, it's connected to the pelvis, and a lot of people have like said, oh, I've tried muscle relaxers, I've tried this, I've tried that.
Temporary fixes.
Exactly. And I think that's, again, I can go off on this about a whole nother podcast, but like, the current medical field is just trying to throw medicine or pills or drugs at things, and it's like, but really it's just muscle tension, like, or fascial restriction that needs to be adjusted. And
I'd actually, and just sitting here thinking and talking, I would love to actually do a part 2 but have it in a spacious area where you're actually like performing these things. You can,
Sure.
you can show me how to do them and fix my lower back,
for
maybe.
sure,
yeah. So, okay, oh my God, when I was doing business administration. I don't know why I had to take these like biology classes, or maybe who knows what I was doing back then. And oh my God, the body was complicated with the muscles and everything. So explain the pelvic area to me and the science of it a little bit.
So
I'm visual.
Here we have, like, this is the front of your pelvis here. And then we got the back there. That's like where your spine is basically. It's a continuation. That's our tailbone that we broke so many years ago.
That low, okay.
Yeah. But as you can see, there's like all these, like, the red is all muscles.
Okay.
And inside, so this is like as if you're looking down at yourself, we got like bladder, uterus, rectum. So that's kind of how it sits in your body. So you can see like how if you have a baby, the uterus grows here and it presses down on the bladder there.
It makes sense with back pain as well.
Right.
Okay.
Right. But like here, you know, it's not all in isolation. Like there's still muscles. I know it's not on my model here, but like these ligaments here get super tight. And again, that low back area that I love to treat is actually the SI joint right here, sacroiliac.
Yep.
And that's what a lot of people, like, again, it's the prolonged standing, prolonged sitting, getting out of bed in the morning. If you have low back pain, that's usually where it's coming from. Okay. Doctors will diagnose it as like degenerative disc disease. And I'm like, no. And so I usually just start treating that. And you got to think, if this is moving too much and it's out of alignment, again, now you're pulling on muscles, sciatic nerve comes out of there, you know, that.
Have you been examining me for the past few weeks?
You know, it's very common. It's very common.
Because right now I know I need a chiropractor, a massage, and at one point, very short period, I was like kind of good at like working out. And I would do like core work, like strengthening the back. And my back hurt so much less.
Yeah.
It really did. So to your point, not everything is medicine. Not everything is a disease. Because like I said, when I was doing those simple like back strengthening exercises, I literally felt the difference.
Well, and I think a lot of people, like I focus on core neutral exercises. So like crunches, like that's putting a lot of strain on your back. So you do definitely want to, and that's part of actually pelvic floor PT is working on getting the innermost muscles active to help stabilize everything, which does help actually with then that SI joint issue.
It's more like a balance of it.
Exactly.
Not so extreme.
Exactly.
Yeah, and like I said, I feel like, and sometimes too, I mean, that's why they have personal trainers where it's just like you even have to be taught how to like work out properly because you can obviously pull something.
Right.
So I like that because you kind of went into some of the services and some of the benefits. Lower back is your favorite. What other kind of benefit or services?
Yeah, so I mean with like the pelvic floor itself, kind of going back to posture. So again, if we're all here, that actually really tightens up these back muscles here, which I don't know if you can really see, but that's kind of where a good chunk of the pelvic floor muscles are. Okay. And so a lot of people. Like pelvic floor is obviously good for people who have incontinence or leakage, coughing, sneezing, laughing, or even urgency to run to the bathroom. It can also be like pain, just general pain, pain with intercourse or like any like penetration, we'll say. Right. Even when you go to the OB's office and they have like that speculum, all that fun stuff. Yeah. It can be prolapse where you kind of have some of those like organs pressing on the wall of the vaginal canal there. It can be a whole lot of different things. And honestly, something that I really focus on is scar tissue. The number of women I work with that have had abdominal surgeries, C-sections, hysterectomies, gallbladder removal, appendix removal, whatever, that scar tissue is kind of laid down like a spider web. And I usually use the example of like scrunching up your shirt, right? So this is the scar tissue, this is your spider web. You try and move it, it's not going anywhere. Okay, gotcha. So I try to mobilize the scar tissue so that way it can move normally.
Interesting.
If it's pinched down, it can be pinching on nerves. So then those nerves aren't functioning as normal, whether it be motor, sensory, or it can be pinching down on like function. But again, like if you're sitting here too and you have that tight pelvic floor in the back, I usually say we need to get length before we can get strength, right? If you're here, you're too tight. You try and do a contraction, you're not getting an effective contraction. So we have to stretch things out. We have to get things mobilized before we can start working on strengthening and other activities to kind of prevent pain, to prevent the leakage, all of those. Yeah. It's all connected. Right?
It's like definitely, I know, it's definitely like a build. I'm like, oh my God, you're definitely preaching to me. I'm just like, because I'm just going through my mind, green.
Right.
All those things I feel. And it's definitely, and I think that's the challenge of like the discipline of working out, because you want to just get to the result. But like you said, it's as simple as, let me stretch and touch my toes daily. Okay, now let me add this to that. And I think that's probably guilty. Yeah. Something I need to like get better at. Because like I go through days with pain. I just ignore it. My tolerance is so high. I'm just like, it's fine.
Yeah, and honestly, I love so bad. I love that you said like the discipline of it all too, because that's so true. I think a lot of people go to PT and they think like, oh, you'll just fix me. And I'm like, I'll tell you what to do, but
you're not there 24/7.
Exactly. Yeah. And it is, I've seen something on like the internet, some motivational quote once, and it was like, it's difficult to not exercise because then you feel lethargic all the time, but it's difficult to have the discipline to exercise. Like, choose your difficult. It's difficult either way. And so I just really loved that, because I'm like, that's so true. Like, it's not, sunshine and rainbows either way.
But it's like positive and negative. I said it, and I had to personally learn that myself. I used to have a negative mindset, negative attitude. You just find the negative before the positive, and that even takes energy. So I'm like, well, if I'm going to burn energy in any way, let me try to turn it around, change my perspective, become more positive. And yes, it's still a kind of energy, but it's like a lighter energy. Like, okay, motivating. Okay, next step. And I think if a lot of people even started there, that would help them, get encouraged, want better for themselves.
Yeah.
This looks deceiving. I'm 35. Yeah, look
great.
I do. Ask me how I feel. Or like if I ran a quick couple minutes, it's terrible.
Yeah, supposedly 30 is when it all goes downhill. Right?
It has been a little bit. And I'm like, okay, I'm feeling the difference, but we're still going. But like, I probably need to come out with a basic routine. I got a yoga mat thing at home. Okay. It's in the closet.
But that's one step in the right direction. You got it.
Yeah, but I'm just like, it would be nice to like feel good.
Yeah.
And I get kind of develop that like basic routine, because life is going to be what it's going to be busy nonstop.
I mean, don't get me wrong, like my workout routine, like there's days where I'm like, oh, gosh, I really don't want to work out, but I'm like, but if I fall out of it, it's going to be so much harder to get back into it than it is to just like push through it and maintain it. So, a lot of my older patients are like, start taking care of your body now. You will thank yourself later. And I think that's the issue, almost like the ignorance of youth is like, oh, but I'm fine now. I'll just deal with it later. But it's like, no, you're setting yourself up for success later now.
I have to speak on that so well. First of all, I said, I'm 35, but I feel like a much older soul. Yeah. But I said, I'm even more mature in my age, because I have had the luxury of working with elder people in home care. And that is so spot on. Yeah. It is a real thing. And I said, I'm in my 30s, so that's considered the age you have to start doing that.
Right.
And when I tell you, or I like to call them clients, 60s, 70s, I mean, jacked up.
Yeah.
Knees, the one lady, you could hear it crunch.
Oh yeah.
But these are ladies, because back then you work, push yourself. No, you're fine now. You're young. Messed up joints. They can't even stand straight. And I'm looking at that, and I'm like, I have started paying attention to my body a lot. Elder people are like gold. Their wisdom, listen to them, and I swear with that, I have been so much more conscious of. I'm taking my glucosamine. I'm taking my calcium. I'm taking, what I mean?
Take those supplements.
It's a real thing. So I'm in that part. I'm super grateful, but that is such a real thing, and I have to like practice it myself. Is take care of your body now, because we're already past if you're a certain age. So if you can keep the maintenance.
Yes, definitely.
It's a very real thing. I was
going to say, I hate to tell you this, but it is like 25 to 30 that your body's like. At its maximal function.
Right. So I'm a little late.
Well, that's not to say, though, like you can still, your body does adapt to the loads you place on it. So you can still gain muscle, gain strength.
Yeah.
But it just is going to take a little bit longer than when you were 16.
Yeah.
Is all.
And like I said, now I'm just, in my head, so it's funny, my mom got me these cute little balloons, and I'm like, I'm really 35. But then I'm like, I don't look it. But I said, I'm starting to feel it. Okay, I got it. So you mentioned doing mobile and virtual visits, which is actually kind of interesting. I like that. So if somebody wants to get in contact with you or set something up like that, how does that work?
Yeah. Like you can go to my website. It's resilienceptwny.
Okay. I'll be sure to tag that.
Yeah. Okay. And it should have my phone number, email. There's a contact form on there as well. You could reach out through Instagram. I'll be honest, I'm really not a big social media user, but I have it. And so I do try and get back within 48 hours, though, because, most of the day I'm out working with patients. And I'm not going to be like, oh, excuse me, hold on.
Inquiry.
I'll be back in 5 minutes.
Right.
So I usually do end up responding closer towards the end of the day just for that reason. But typically email, phone, text, whatever.
Here's the golden question. Do you take insurances?
So I don't. But
I don't blame you. I don't blame you.
And that literally is just because...
I get it.
Again, insurance is like, you can only work on the elbow. And I'm like, no, we're working on the whole body because that's what's beneficial for you. But it's so I can have time to really assess, digest, and focus on what you need. And also going to your house too, it's like... The
convenience.
I mean, insurance won't cover that. You know what I mean? For the time that I take for all of that.
It's too convenient. Yeah. It's considered a luxury, even though you can't leave your house because your joints are messed up. But first of all, a couple things to that, and that's great. This is, me coming from the business aspect of things. So, because I know people with certain mindsets when they hear certain things. Yes, you don't take insurance. Number two, though, this is our well-being. This is our health. You find money to spend on plenty of other things we don't need.
Oh, for sure.
So what I wish for people is to look at it as an investment in yourself.
Yeah, you get one body for life. You can drop...
Don't cheap out on it.
Exactly. Like, you could drop $400 on fixing your car
or
real
lashes,
quick like that.
Or shoes. Or that all-inclusive trip. But even and it's just prioritizing. Yes, as adulting, you have to learn to understand and prioritize, certain things.
Right.
But even with that being said, I respect you for not, working with insurance just to, get you, because that shows the respect and quality of work that clients are going to get with you.
Right.
You know what I'm saying? In the sense of, insurance dictates what part you can, work on, whereas you see the importance of, well, if this is hurting, I need to work on this as well. That's thorough, that's quality, that's good business, and I think a lot of the time what America has become is so rush, instant gratification. Well, that takes too long. Well, that's too much money. And the reality is, it's just it is an investment. Right.
And not only that, my appointments are an hour long. Well,
and that's a long time.
Evals are an hour and a half, actually, but an hour long.
I get tired after 15 minutes.
But through insurance, that's about all you get with a PT, is about 10, 15 minutes. And so, again, it's what can you really get done in that time? I will make the disclaimer, too, that, doing this type of PT, it's not twice a week like a lot of insurance-based are either. It's
because it's so short, but that's the method to the madness of money.
Exactly. So at the end of the day, too, you're probably spending less money coming to me than if you're going twice a week with a deductible to an insurance-based company, right?
So, like I said, maybe people are working with you, twice a month, maybe 3 times a month?
Yeah. I have some people who I see every week. I have some people who I see every other week. I have some people I see once a month. And it's just I work it out with you. I'm not going to push you one way or the other, but it is more so a self-care, right? It's not...
Yes, self-care. Thank you.
It's not rehab, it's self-care.
So first of all, I love your energy walking in the door. Second of all, this is why I love doing this, because I think there's such a narrow-mindedness and, I talk about anything and everything. Like, how does this relate to like this? Yes, your day job can relate to physical therapy.
Right.
And that's what I love expanding on. And yes, physical therapy, that's what I say. It's the investment in yourself because it is self-care. You're sitting at your
100%.
desk with back pain and probably knee pain and all this pain. And something like that twice a month, once a month even.
Right.
You know what I'm saying? And
Just
it's
like a body check-in, make sure everything's moving correctly,
Yes, but that self-care thing.
Oh, yeah.
That's my favorite. And that's the thing. I think like people underestimate the worth of self-care, not only because these things, when you feel good, you feel better mentally, emotionally,
Oh, yeah.
obviously physically. And it improves like so much more. Like, and on a serious note, I literally just texted my boyfriend. I said, I had a little oopsie accident when I was in Mexico. Kind of my own fault, but it's fine. I survived, thank the Lord. And, I've been hurting for a little bit, aches and pains. And I said, I've been so angry and irritated because the pain, it's taking longer.
Away. Yeah.
It's taking longer to go away. And I'm like,
because we're 35 now.
No. And I'm like, no, I pop a little thing, a little wine, a gummy. I wake up and I'm like, I'm good. And I'm like, okay. No, a little soreness still there. So, with that being said, it slows you down in the sense of, ooh, I need to take care of this.
Yeah.
I need to.
Sooner the better, too. The quicker the recovery.
Yeah, and I'm like literally sitting here like, when do I have some availability? Dr. Cara, I need you.
Yeah, exactly.
Yeah, I mean, and on a serious note, just you saying like the lower back, like that if you felt my lower back, you'd be like, honey, 3 times a month.
I see that every day.
Yeah, so.
Twice a week for you, actually.
Right. Probably, yes. Yeah. But that is wonderful. I will be sure to tag your website. I love what you're doing. These classes, do you do these pop-up every so often? Or
Yeah. I mean, I just try to coordinate and collaborate with other providers, I guess. I got a couple right now planned for January, but I haven't put anything out about that
Well,
yet.
be sure to share. We'll definitely advertise it for you. But even any small business owners, sometimes I know companies or small businesses are looking to do like pop-ups or events.
They can always contact me.
Great.
I'm more than happy.
And then Resilience PT?
Yep.
Okay, well, this is Dr. Cara. Like she said, self-care, take care of your body. It is an investment. Don't cheap out on yourself,
exactly.
And
listen to the elderly.
Yes, they're wisdom. They're golden rules. Yes. But thank you so much for joining me.
Thanks for having me. This was a lot of fun.
We may have that part 2 where we'll get a little more involved and have her show.
Where she gets her PT session.
Right. I'm trying to get a free session. No, I'm kidding. Yeah, so you heard it here on Just Ask M. Stay tuned, subscribe, and continue to support.